Welcome to another episode of Med Madness, where we dive deep into crucial medical topics that every medical student needs to master. Today, we will explore an essential aspect of culturally competent care, focusing specifically on the practice of coining, a traditional healing method originating from China and Southeast Asia. Understanding cultural practices like coining is vital for medical students and healthcare professionals. It helps build trust and respect with patients from diverse backgrounds, ensuring that we provide care that is not only effective but also culturally sensitive. By the end of this podcast, you will have a solid understanding of coining, its implications in healthcare, and how to manage it ethically and sensitively. In this episode, we will cover the cultural background and method of coining, the potential risks and benefits of coining, ethical considerations and management strategies, and a brief real-life case study illustrating the practice and its implications in a clinical setting. First, let's talk about the practice of coining. Coining, also known as Cao Jiu or scraping wind, is a traditional healing practice used in China and Southeast Asia. The method involves rubbing a coin or another hard object on lubricated skin, typically on the chest or back, in a linear and symmetrical pattern. The goal is to induce erythema, which later develops into ecchymoses. Practitioners believe that this process releases heat, negative energy, and illness from the body, promoting healing and wellness. While coining can appear alarming due to the resultant bruising, it is generally safe and carries minimal risk when performed correctly. It is important for healthcare providers to recognize these signs and understand their cultural significance to avoid misinterpreting them as signs of abuse. Next, let's discuss ethical considerations and management. As healthcare providers, it is crucial to respect and acknowledge the cultural practices of our patients. Parents who practice coining should not be discouraged or accused of child abuse, as their intention is to heal, not harm. Instead, we should engage in open and respectful dialogue to understand their perspectives and offer alternative treatments if necessary. For instance, if a child presents with fever or pain, healthcare providers can suggest less painful alternatives such as ibuprofen or appropriate antibiotics if indicated. It is also essential to educate parents about these options while showing respect for their cultural practices. Moving on to differential diagnosis. It is important to differentiate the bruising caused by coining from other potential medical conditions. Ecchymoses limited to areas subjected to coining are not indicative of platelet disorders or coagulopathy. However, if a patient presents with bruising in non-traumatized areas, hepatosplenomegaly or lymphadenopathy, further evaluation for hematologic disorders is warranted. Now let's consider a real-life case study. A 5-year-old boy is brought to the clinic by his mother, who is concerned about his persistent cough and fever. On examination, the boy has linear bruises on his back, consistent with coining. Instead of assuming abuse, the physician respectfully inquires about the bruises. The mother explains that she performed coining to alleviate her son's symptoms, a practice she learned from her mother. Understanding this cultural context, the physician acknowledges the mother's intentions and explains that while coining can be helpful, using ibuprofen could also reduce the fever more effectively. The physician provides the necessary medication, reassures the mother, and respects her cultural practices, thus building a strong patient-provider relationship. To wrap up in today's episode, we explored the practice of coining, its cultural significance, and the importance of providing culturally competent care. Remember, respecting and understanding cultural practices like coining can enhance patient trust and improve healthcare outcomes. To reinforce your learning, don't forget to engage with the pre- and post-podcast quizzes and review the Anki flashcards available on our platform. These tools are designed to help you retain key information and apply it effectively in your clinical practice. Thank you for tuning in to Med Madness. Stay curious, stay compassionate, and keep learning. Until next time, take care.